was diagnosed with Hodgkin's lymphoma when I was 10 years old.
I was diagnosed with CML, it's chronic myeloid leukemia, and I was 16 years old.
I was diagnosed with Hodgkin's disease type 2A when I was 16.
My diagnosis was a brain tumor. I was 7 years old when I was diagnosed with optic nerve atrophy.
I was diagnosed with Hodgkin's lymphoma and I was 11 years old.
I was diagnosed with acute lymphoblastic leukemia when I was 11 years old.
I was diagnosed with stage 4 Hodgkin's lymphoma when I was 10 years old.
Childhood cancer has gone from being an almost incurable disease 50 years ago to now having more than 350,000 childhood cancer survivors in the United States.
The adult survivor population is unique. They had cancer as children and have sort of completed their therapy, but have now moved into young adulthood and later adulthood. Everybody should have a primary care physician, but it's particularly important for this group of patients because they had such a unique set of treatment and issues when they were younger.
The long-term effects emotionally for adult survivors can be largely driven by the age that the survivor was when they were diagnosed and treated.
40% or more of patients are going to be discharged from their pediatric center and are going to be receiving their medical care in the local community. There's going to be another portion that are treated continuously in a pediatric setting, even as adults, and then there's some that will transition from a pediatric program to an adult survivor program.
Since they had cancer when they were young, don't necessarily know the treatment that they underwent, or their parents sort of spearheaded their care. By the time they get to be young adults, they may not have a great understanding of what they went through. It's really important for the young survivor to say, I know I had some sort of treatment, I had cancer, I'm not exactly sure what the consequences of those treatments or that original condition could be, but hopefully if I bring this information to my primary care physician, they can look into it and figure out how to treat it and what they need to look into for my own health.
Integrated psychosocial care is a critical component of quality cancer care because we know that emotional concerns and psychosocial obstacles can interfere with the outcomes from cancer treatment. And we have research that indicates that adult survivors of childhood cancer have an increased risk when compared to the general population for experiencing things like anxiety about their health or post-traumatic type anxiety, as well as depression.
The recommendations for follow-up care are very unique for each individual. A lot of it depends on when a patient was diagnosed, so how old they were, what symptoms they had at the time, what the original cancer diagnosis was, and what the exact treatment was that they had.
Family members do play a very critical role. For parents, they're often the most reliable source of information for the survivor about the survivor's diagnosis and their treatment history, of course, in conjunction with the survivor's medical record. Family members often do remain very involved in making sure that survivors remain engaged in long-term follow-up care programs.
We dictate our care and our screening tests, et cetera, that we do based on the Children's Oncology Group long-term follow-up guidelines. And really they're a resource for physicians to take care of childhood cancer survivors. There's information on different treatment modalities that children and adolescents receive for their cancer treatment. So we'll find information on the late effects of those treatment factors, what some of the high-risk factors are, and then also what sort of screening tests need to be done because of having received that treatment. In addition to the guidelines, there are health links that are really more the patient education tools. Some of the issues that adult survivors of childhood cancer face are related to knowledge deficits about the treatment that they received and some of the risk factors that they have. If a patient then can get their medical records together, find out what their treatment consisted of, they can go to the guidelines on the website and bring that into the doctor's office.
What we're treating everybody with it as a group is evolving, and so the field keeps changing. The late effects we're going to have to be monitoring for, the way we're going to be taking care of patients is really going to change over time.